stop whatever you're doing right now. At this very moment, something dangerous could be happening in your legs, or in the legs of someone you care about. Yes, you saw the thumbnail and you're right. If you're feeling these symptoms, you need to pay attention and take it seriously. If you're not, do the same anyway. It's the best precaution you can take for yourself and your loved ones. There is a silent, terrifying signal that shows up in your legs, and the vast majority of people completely ignore it. This signal means your circulation is weakening little by little, dramatically increasing your risk of serious falls, intense pain, loss of mobility, and even far more severe complications. Worse still, most doctors don't clearly warn you about this, and when they do mention it, they usually only offer expensive medications loaded with unwanted side effects. I'm Dr. Choi Smith, a vascular health specialist with over 20 years of experience helping people restore vitality and comfort in their legs, and today you're going to discover how to reverse this process naturally, right at home, using simple ingredients you probably already have in your kitchen. In just a few days you can feel your legs warmer, eliminate nighttime cramps, reduce that pins and needles tingling, and regain the freedom to move without fear. Stick with me until the end, because I'm going to reveal the exact protocol that has already helped thousands of people save their legs, and it might even surprise your own doctor. Feel free to write your city or country in the comments below. It's always a great pleasure to hear from people all over the world sharing their stories and experiences here on the channel. And if you value content that delivers real, life-changing health information, hit that like button right now and subscribe to the channel. That way you'll never miss an update and you'll keep getting practical tips that can genuinely improve your quality of life. Let's get started right now. This silent signal I'm talking about isn't some rare disease. It's happening to millions right here in the United States, often without people even realizing it until it's advanced. The core issue is poor circulation in your legs, specifically, when the arteries that carry oxygen-rich blood to your lower body start narrowing or getting blocked over time. This condition is most commonly linked to peripheral artery disease, or PAD, where plaque buildup restricts blood flow, starving your leg muscles, nerves, and tissues of the oxygen and nutrients they need. What makes this so dangerous is how sneaky it can be. Many people brush off the early signs, thinking they're just normal aches, tiredness from a long day, or something that comes with stress or sitting too much. But ignoring them allows the problem to worsen quietly. Here are the most common, and most frequently ignored, warning signs that your leg circulation is declining. First, cold feet or legs that feel unusually chilly, even when the rest of your body is warm. Your feet might feel like ice, or one leg could be noticeably colder than the other. Second, that annoying pins and needles tingling or numbness in your legs, feet, or toes, especially when you're resting or sitting for a while. It's like your limbs are falling asleep for no reason. Third, nighttime cramps or Charlie horses that wake you up, painful muscle spasms that hit hardest when you're trying to sleep. Fourth, aching, heaviness, or fatigue in your legs that gets worse with activity like walking, climbing stairs, or standing for long periods, but eases when you sit or rest. This is often called claudication, and people frequently mistake it for just being out of shape. Fifth, swelling in your ankles, feet, or lower legs that doesn't go away quickly, or skin that looks pale, shiny, tight, or even slightly bluish or discolored. Sixth, slow-healing sores, cuts, or wounds on your legs or feet, even small ones that should clear up in days but linger for weeks. And seventh, visible changes like bulging varicose veins, thinning hair on your legs, or brittle, slow-growing toenails. These aren't just annoying inconveniences, they're your body screaming that blood isn't getting where it needs to go efficiently. Left unchecked, this reduced flow can lead to serious risks, more frequent and severe falls from weakness or numbness, chronic pain that limits your daily life, non-healing ulcers that can become infected, and in the worst cases, much more drastic complications like tissue damage or loss of mobility. Studies show that peripheral artery disease affects millions of adults across the country, with many cases going undiagnosed because the symptoms are so easy to dismiss or attribute to other causes. Think about it. How many times have you or someone you know said, "My legs just feel tired today," or "I guess I'm just getting older"? That's exactly how this signal gets ignored, until it's louder and harder to fix. But here's the good news, catching it early and understanding what's really happening puts the power back in your hands. In the next part, I'll break down the science behind why this happens, so you can see exactly what's going on inside your body and why natural steps can make such a big difference. Now that we've identified the warning signs your legs are sending, let's dive into what's actually happening inside your body at a deeper level. Understanding the science makes it clear why this circulation decline isn't just part of life, and why targeted natural steps can turn things around so effectively. At the heart of healthy circulation is a tiny but incredibly powerful molecule called nitric oxide, or NO for short. Think of nitric oxide as your body's natural vasodilator. It acts like a signal that tells the smooth muscles in your artery walls to relax and open up. When NO levels are good, blood flows freely, delivering oxygen and nutrients to every part of your legs, from muscles to skin to nerves. This keeps your legs feeling warm, strong, and responsive. Nitric oxide is produced mainly by the cells lining your blood vessels, the endothelium. When everything is working right, these cells release NO in response to things like increased blood flow, from walking or exercise, certain foods, or even sheer stress from blood moving through the arteries. The result? Wider vessels, better flow, less strain on your heart, and tissues that get exactly what they need. But here's where the problem starts. In many people, nitric oxide production and availability drop over time. Several factors contribute to this decline. First, oxidative stress, basically, an imbalance where harmful free radicals, like superoxide, outnumber protective antioxidants. These free radicals can directly attack and destroy nitric oxide before it does its job, or they can damage the endothelium so it produces less NO in the first place. Second, inflammation, low-grade, chronic inflammation, often measured by markers like C-reactive protein, irritates the vessel lining, making it harder for endothelial cells to make and release NO effectively. Third, plaque buildup from atherosclerosis, the same process that narrows coronary arteries can affect leg arteries too. As plaque accumulates, it physically restricts flow and further impairs the endothelium's ability to produce nitric oxide. Studies from major institutions, including research published through the National Institutes of Health, show that reduced nitric oxide bioavailability is a key player in peripheral artery disease and related circulation issues. For example, when NO levels are low, vessels stay tighter, blood flow to the legs decreases, and tissues become oxygen-starved, leading directly to those symptoms we talked about: coldness, cramps, tiredness, tingling, and slow-healing wounds. Even more concerning, this reduced NO creates a vicious cycle. Poor flow means more oxidative stress and inflammation, which further lowers NO production, making the problem worse over time. That's why early signs can snowball into bigger issues if ignored. The good news? Nitric oxide pathways are highly responsive to natural interventions. Certain foods and habits can boost NO production by providing raw materials, like nitrates from vegetables, reducing oxidative stress, or supporting endothelial health directly. In the next section, we'll look at why conventional approaches often fall short, and then move straight into the powerful, evidence-based natural solutions that target this root cause head-on. By now you understand the critical role nitric oxide plays in keeping your leg arteries open and blood flowing freely. When NO levels drop due to oxidative stress, inflammation, plaque buildup, and endothelial dysfunction, the symptoms we discussed start appearing, and worsen over time. So why don't the standard treatments most doctors recommend fully solve the problem for everyone? First, let's look at the medications commonly prescribed for peripheral artery disease, or PAD, right here in the United States. These include antiplatelet drugs like aspirin or clopidogrel to prevent clots and reduce heart attack or stroke risk, statins to lower cholesterol and slow plaque buildup, blood pressure medications such as ACE inhibitors or ARBs to keep vessels from narrowing further. Sometimes cilostazol, a vasodilator that can improve walking distance for some people with claudication. These medications are valuable, they help reduce overall cardiovascular risk and can slow disease progression. Guidelines from organizations like the American Heart Association and the National Heart, Lung, and Blood Institute strongly recommend them as part of standard care. However, they often fall short in addressing the root cause we've been discussing: the decline in nitric oxide bioavailability and endothelial function. Statins primarily target cholesterol, antiplatelets focus on clotting, and blood pressure meds manage hypertension, but none directly restore or boost nitric oxide production in a sustained way. Many people still experience ongoing leg symptoms like pain, cramping, coldness, or fatigue even while on these therapies. Side effects can also be an issue: muscle pain or weakness from statins, bleeding risks from antiplatelets, headaches or palpitations from cilostazol. For some, these make sticking with treatment difficult. Next, supervised exercise programs and lifestyle changes, like quitting smoking, eating heart-healthy foods, and structured walking, are excellent first-line recommendations. They improve circulation indirectly and can boost NO through sheer stress on vessels. But for many with moderate to severe symptoms, these alone aren't enough to reverse significant narrowing or restore comfortable mobility quickly. When symptoms persist or worsen, especially with non-healing wounds or severe pain, doctors often turn to procedures. Angioplasty with or without stenting, a catheter delivers a balloon to open the narrowed artery, sometimes leaving a stent to keep it open. It's minimally invasive, often outpatient, and can provide good short-term relief. Bypass surgery. For more extensive blockages, surgeons create a new path around the obstruction using a vein or synthetic graft. These interventions can be life or limb-saving in advanced cases, restoring flow and helping heal ulcers or prevent amputation. However, they come with limitations and risks. Angioplasty and stenting may not work as well for long, calcified, or multiple blockages. Re-narrowing, restenosis, happens in some cases, requiring repeat procedures. Bypass surgery is more invasive, with longer recovery, risks of infection, graft failure, or complications like bleeding or clotting. Neither procedure fixes the underlying endothelial dysfunction or low nitric oxide, so without ongoing lifestyle and medical management, problems can return. In short, while these conventional options are important tools, especially for preventing heart events or saving limbs in severe PAD, they often treat symptoms or mechanical blockages rather than fully restoring the body's natural ability to produce and use nitric oxide effectively. That's why so many people continue searching for better, more root-cause-focused solutions. The exciting part is coming up next: powerful, evidence-based natural approaches that directly support nitric oxide production, reduce oxidative stress, and improve endothelial health, all from simple ingredients you can use at home. These target the very mechanisms we've been exploring, often complementing or even outperforming what conventional medicine offers alone for symptom relief and long-term vascular wellness. The great news is that you don't have to wait for a prescription, a procedure, or years of gradual change. Science shows that certain everyday foods and simple preparations can dramatically boost your body's nitric oxide production, reduce oxidative stress, support healthy endothelial function, and improve blood flow to your legs, often faster and with fewer downsides than you might expect. Today I'm sharing the 3 most powerful, evidence-backed natural drinks that directly target the root mechanisms we've discussed. These are easy to make at home, use affordable ingredients you can find at any grocery store across the United States, and work synergistically to restore warmer, stronger, more comfortable legs. Drink 1, Beet Lemon Ginger Circulation Booster. Beets are one of nature's richest sources of dietary nitrates. Your body converts these nitrates into nitric oxide through a 2-step process involving saliva and gut bacteria. Research from institutions like the National Institutes of Health has shown this pathway can significantly increase NO levels and improve blood flow within hours. Adding fresh lemon provides vitamin C, a powerful antioxidant that protects NO from destruction, while ginger reduces inflammation and enhances circulation further. Recipe: makes 1 serving, prepare fresh each evening. 1 medium beet, about 4 to 5 ounces, peeled and chopped. Juice of 1 fresh lemon. 1-inch piece of fresh ginger, peeled. 8 to 10 ounces of water, or filtered water for best taste. Blend everything until smooth, strain if you prefer a smoother texture, and drink 30 to 60 minutes before bed. Start with half a beet if the taste feels strong at first, your palate will adjust quickly. Many people notice warmer feet and reduced cramping within just a few nights. Drink 2, Pomegranate Cacao NO Explosion. Pomegranate is loaded with potent polyphenol, especially punicalagins, that protect and activate the enzyme that produces nitric oxide while fighting oxidative stress. Raw, unsweetened cacao adds flavonols that improve endothelial function and vessel dilation. Studies published in major cardiology journals show this combination can enhance blood flow and arterial health remarkably well. Recipe: makes 1 serving, ideal mid-morning or afternoon. Seeds from 1 whole pomegranate, or 4 to 6 ounces of 100% pure pomegranate juice with no added sugar. 1 heaping tablespoon of raw, unsweetened cacao powder, look for non-alkalized for maximum flavonols. 8 ounces of water or unsweetened almond milk. Optional, a few drops of stevia if you want a touch of sweetness. Blend or whisk vigorously until frothy. Sip slowly. The rich, slightly tart flavor is surprisingly satisfying. People often report less leg heaviness and better endurance during daily activities after a week or 2. Drink 3, Green Tea Garlic Honey Vascular Reviver. Green tea's catechins, especially EGCG, boost nitric oxide synthase activity and reduce inflammation. Fresh garlic releases allicin, a sulfur compound with powerful vasodilating and anti-inflammatory effects. Raw honey adds natural sweetness and additional antioxidants while soothing any strong flavors. Recipe: makes 1 serving, great as an evening wind down. 1 green tea bag, or 1 teaspoon loose leaf green tea. 1 to 2 fresh garlic cloves, crushed and let sit 10 minutes to activate allicin. 1 teaspoon raw honey, local or manuka if available. 8 to 10 ounces hot, not boiling, water. Steep the tea and garlic together for 5 to 7 minutes, strain, stir in honey, and enjoy warm. If the garlic taste is too bold, start with 1 clove and build up. This drink not only supports leg circulation but also helps maintain healthy blood pressure and overall vascular resilience. Bonus tip: to supercharge all 3 drinks, incorporate nitrate-rich greens like spinach, arugula, or Swiss chard into your daily meals, and add a handful of walnuts or almonds. Their healthy fats protect NO and support vessel flexibility. These aren't magic potions, they're backed by solid research on nitric oxide pathways, but when used consistently, they address the decline we've been talking about at its source. You now have the 3 powerful drinks that directly support nitric oxide production, protect your blood vessels, and improve circulation where it matters most, your legs. The key to real, lasting results is consistency and a smart, gradual rollout so your body adapts easily and you build momentum without overwhelm. Here's the exact 30-day protocol I recommend: simple, realistic, and designed for noticeable changes week by week. Week 1, gentle introduction, build the habit. Goal: get comfortable with 1 drink per day and start noticing early signals of better flow. Days 1 to 3, start with drink 1, beet lemon ginger, every evening, 30 to 60 minutes before bed. This nitrate-rich drink gives the fastest initial NO boost. Days 4 to 7, continue drink 1 every evening, and add drink 2, pomegranate cacao, once daily, ideally mid-morning or early afternoon for an energy and circulation lift. Daily habit: take a short 10 to 15 minute gentle walk, indoors or outdoors, at a comfortable pace. The movement creates natural shear stress on your arteries, amplifying NO release. What to expect: many people feel their feet and legs warmer within 3 to 7 days, with lighter nighttime cramps starting to ease. Track how your legs feel each morning, jot it down or note it in your phone. Weeks 2 to 4, full synergy, maximize results. Goal: combine all 3 drinks for cumulative benefits and lock in improvements. Every day. Morning/midday, drink 2, pomegranate cacao. Afternoon or early evening, drink 3, green tea garlic honey. Before bed, drink 1, beet lemon ginger. Daily habit: increase gentle walking to 20 to 30 minutes total, split into 2 sessions if easier. Add simple calf raises or ankle circles while seated if walking feels challenging at first. Bonus boosters: include 1 nitrate-rich salad or side daily, spinach, arugula, or Swiss chard, and a small handful of walnuts or almonds. These support vessel flexibility and protect NO. What to expect week by week. Week 2, reduce tingling/pins and needles, less leg heaviness during the day, better sleep from fewer cramps. Week 3, noticeably warmer legs even in cooler rooms, easier walking without stopping as often, improved skin tone and less swelling. Week 4, sustained comfort, greater confidence moving around, and often comments from others like, "You're walking taller." Many report this is when the biggest aha moment hits, realizing how much they'd been tolerating before. Tips for success. Prepare drinks fresh each day for maximum potency. If taste takes adjusting, start with smaller amounts and gradually increase. Stay hydrated, good water intake helps circulation. Listen to your body: if any drink feels too strong, reduce portions temporarily. Keep a simple journal, note daily symptoms on a 1 to 10 scale: coldness, cramps, energy. Seeing the numbers improve is incredibly motivating. This protocol isn't about perfection, it's about steady, enjoyable progress. After 30 days, most people feel a clear difference in leg comfort and mobility. At that point, you can maintain with 2 drinks daily or continue all 3 if you love the results. In the final chapter, I'll wrap everything up with encouragement and your next steps to keep this momentum going. You've now seen the full picture, the silent signal your legs have been sending, the science of why circulation weakens when nitric oxide levels drop, why conventional approaches often treat only the surface, and the simple, powerful natural drinks that target the root cause directly. This isn't about waiting for symptoms to get worse or accepting discomfort as just how things are. Your legs, and your freedom to live actively, deserve better. Thousands of people across the country have already used this exact approach to feel warmer, stronger legs, sleep through the night without cramps, walk farther without stopping, and regain confidence in their daily movement. The best part? You can start tonight. Pick 1 drink, maybe the beet lemon ginger, to get that quick nitrate boost, and make it part of your evening routine. In just a few days, you may notice the first signs of change: toes that aren't freezing, less tingling, easier steps. By the end of the 30 days, many people look back and wonder why they waited so long. This protocol is safe, affordable, and fits right into your life. No fancy equipment, no doctor's appointment required to begin. Of course, if you have existing health conditions or take medications, it's always wise to mention these natural additions to your healthcare provider so they can support your progress. If this video has given you hope, clarity, or a clear next step, I'd love for you to take 2 quick actions right now. First, hit that like button. It tells YouTube to show this to more people who need to hear it, and it helps the algorithm share life-changing information further. Second, subscribe and turn on notifications so you never miss future videos with practical, evidence-based tips to protect and restore your health naturally. And while you're here, drop a comment below. Which of the 3 drinks are you going to try first tonight? Or share your city or state. It's always inspiring to see where everyone watching is tuning in from across the United States and beyond. Your legs are listening. Your body is ready. Start this evening, stay consistent, and watch how quickly things can improve. Thank you so much for spending this time with me. You took an important step today by watching until the end, and that commitment alone puts you ahead of most people. Here's to warmer legs, better nights, and a more active life. I'll see you in the next video. Take care, and take action tonight.